Welcome to Cancer Episode 4. In this section, we will look at prostate cancer and finally how you can make your body cancer-proof, thereby optimizing your ability to successfully fight off cancer. We will discuss risk factors which increases your chance of coming down with the disease. We will discuss screening tools for prostate cancer and the reason why it is not routinely employed. We will discuss a more sensitive screening tool for prostate cancer, and we will discuss the signs and symptoms commonly associated with prostate cancer. We will introduce the use of some agents which can reduce your risk of prostate cancer and even prevent you from developing this condition. Phillip Academy, the call. We at Phillip Academy believe that our major attribute is our interest in having you be the healthiest version of yourself. We further believe that you can only be your healthiest version of yourself if you are disease-free or if you are able to actively prevent a disease from rendering you handicapped. It is with this commitment we try to ensure that we discuss with you simple steps which you can employ to either prevent cancer or if by chance you're already afflicted, how to reclaim your health. Our approach is a holistic one involving the body, mind, and soul. Prostate cancer and making your body cancer-proof. This is a disease of the male subject. The number of men diagnosed with this condition and dying from this disease is increasing. What are the risk factors, I hear you ask? Among them are advanced age, being black, a family history, and obesity. Why not PSA but CA125? PSA is prostate-specific antigen. Interestingly, there is no screening program for prostate cancer in the UK. The reason advanced it has not been proven that benefits outweigh the risk. PSA test is not always accurate. It is further claimed that there is no reliable test that can pick up prostate cancer that needs treatment at an early stage. Remember that we said the earlier a cancer is found, the more successful we will be at treating the condition. Current tests don't reduce the number of men dying from cancer or from prostate cancer. A value, just a few values to contemplate on, a value of a PSA between 4 and 10 nanograms per ml is considered suspicious. Greater than 10 nanograms per ml is considered dangerous, with a 50% chance of having prostate cancer. Despite the claims as listed above, one sees an incessant request for CA125, that is carcinoembryonic antigen, a blood test used in the screening for ovarian cancer. Interestingly, I've had to counsel many a patient repeatedly who presented to my clinics are very anxious that they may have cancer based on an elevated CA125 value. CA125 is a blood test which is used by GPs ad nauseam as a screening tool to rule out ovarian cancer. This test is non-specific and has raised values in several benign and physiological conditions. For example, it will be raised in a woman who is having her menstrual period. It will also be raised if there is an irritation of a peritoneal cavity, and it is raised in the presence of fibroids and endometriosis. It can also be raised in liver disease or if a patient has a pneumonia. It is a very non-specific blood test and serves to increase anxiety in women whose values are raised. The upper limit of a normal CA125 value is 35. We now combine the CA125 value with two other parameters to obtain a score called the risk of malignancy index to determine whether a patient may have cancer and where she should be treated for this condition. How does CA125 relate to PSA, I hear you ask? CA125 is a marker for ovarian cancer detection. Blood CA125 value increases in about 80% of women with ovarian cancer, and it increases in proportion to disease progression. Note, the CA125 value is increased in about 80% of women with ovarian cancer. It doesn't tell you that every time the CA125 value is increased, it's because of ovarian cancer. All right, so it's a little spin on terminology here. The prostate-specific antigen, or PSA, is the most important tumor marker for prostate cancer. PSA is also secreted by normal prostate tissue, and with benign prostatic hyperplasia. False positives are therefore possible. That is to say, you may be told that your PSA value is high and you have no cancer, because PSA can be secreted by normal prostate tissue as well as in a condition called prostatic hyperplasia, which is a benign condition. PSA sensitivity varies between 9% and 33%, depending on the patient's age. That is, up to 91% of individuals with an elevated PSA do not have prostate cancer. The sensitivity of CA125 for ovarian cancer, on the other hand, is 88.6%. It has a specificity of 72%. Are we able to roll out a national prostate cancer screening program? I hear you ask. Every screening test should have at least two qualities that makes it useful. One, we talk about a high sensitivity and a high specificity. The question is, what do we mean by a high sensitivity? A test sensitivity is the ability of that test to detect an individual with that disease. The specificity of a test is the ability of that test to rule out that disease in a patient without the disease. More recently, there is the entry into the medical armamentarium of the multi-parametric MRI scans, which has a sensitivity of 58 to 96% for detecting prostate cancer. The specificity using this MRI scan ranges between 23 and 87%. And with transperitoneal guided biopsies, it could make screening for prostate cancer a possibility and, as a result, save many lives. What are the symptoms of prostate cancer, here you ask? Frequency of micturition, that's frequency of passing urine. Urgency, that's when you have to go, you cannot hold on. Hesitancy, that is, you have to wait a long time when you go to the bathroom before the urine starts flowing. Incomplete emptying of the bladder, that is to say, you're finished passing your urine, but you feel you could go again. Poor urinary stream, you could imagine it as a mere dribble. Alright, instead of a nice flowing stream, you have basically a dribble of urine. And blood in your urine or in your semen is also a warning feature that you may have prostate disease. What is the modus operandi of Phillip Academy? We suggest a variety of nutrients which can be used on a regular basis to keep your body free of cancer. We aim to help you become the healthiest version of yourself by helping you protect yourself against a variety of cancers. We look at the symptoms which are associated with prostate cancers, and we seek to empower you by encouraging you to act on those symptoms by seeking medical advice. We believe that if you act on the symptoms in a timely manner, the particular health condition will be identified and treated successfully. Remember, our best chance at success is to prevent the disease, and the second best chance is to find the disease at its earliest stage. Prevention. There are many plant-based substances that fight cancer of the prostate. Quercetin is a plant-based pigment which inhibits prostate cancer development in many ways. It encourages prostate cancer cells to self-destruct and inhibits their development. In Vietnam, a prominent herb referred to as the royal female herb targets both prostate and ovarian health concerns. Prostate cancer is divided into androgen-dependent and androgen-independent varieties. The androgen-independent variety seems the more difficult one to treat. A modified citrus pectin called Pectosol C has been shown to be effective against prostate cancer. It slows the rate of PSA doubling time. In other words, it slows down the rate of proliferation of the prostate cancer. A second group of cancer-fighting agents called Prostacade stop the production of new prostate cancer cells and causes existing cancer cells to die. Pectosol C can work independently, but it is more effective when combined with other prostate-fighting agents. How do we make our body cancer-proof? Research published in the Journal of Nature indicates that researchers from Strongbrook University claims that almost all cancers are caused by factors external to our bodies. This gives us hope in that this can be changed or fixed. Carcinogens are varied and arise from different sources: the environment, our behaviors, and infections. Tobacco smoke, major chemicals, heavy metals are all linked to the causation of certain cancers. Exposure to low dose of known carcinogens over an extended period of time may contribute to the increasing incidence of cancer. Infections by a variety of viruses, such as human papillomavirus, that is the virus that's associated with cervical cancer, hepatitis, which is an inflammation of the liver caused by viruses, can lead to liver cancer. Helicobacter pylori, which is a bacterium which is associated with stomach ulcers, is also associated with the development of stomach cancer. And the Epstein-Barr virus, which causes infectious mononucleosis, is also linked to Hodgkin's lymphoma and Burkitt's lymphoma, which are types of blood cancers. Exposure to heavy metals, example lead in the water we drink, mercury which we acquire from fish and other seafoods, as well as the mercury amalgams which are continuously placed in our mouths by our dentists, aluminum from the foils we use to cover our dishes, arsenic from rat poisons which enters our foods from the soil, all increases our risk for developing cancer. Exposure to a variety of environmental toxins such as cigarette smoke, and as we all know and should be familiar with, asbestos increases our risk of certain types of cancers. Chemicals which are known carcinogens are appearing in our medications. I am not sure if you remember that recently there has been a recall of slow-release metformin. It was because of the presence of a chemical in that batch of metformin known as N-nitroso-dimethylamine, which was found to be in a higher than normal concentration in that particular medication. This led to the recall of metformin. Research published in the Journal of Nature indicates that researchers, what can we do, I hear you ask, would have realized that our bodies have an internal army designed to fight off cancerous growths. The internal army can be regarded as our immune system. So one logical starting point is strengthening our immune system. Several foods and the supplements which we take are designed to do just that. These, though, occasionally fail, and the take-home message here is to seek help early. We remember the story of Sister A and Sister M. The ability to present for treatment early is greatly enhanced by performing the AMAS test, that's the anti-malignant antibody serum test, which, although useful in telling us we have cancer, it does not specifically determine the site. Unfortunately, this test is not widely available, but it is a useful step in identifying the presence of cancer in our bodies and gives us a leg up in rendering our bodies cancer-free. Infectious diseases. As indicated above, there are a variety of viruses and bacteria associated with the occurrence of certain types of cancer. The success of HPV vaccine against cervical cancer gives us much reason to await the claim that a vaccine will be available in 2035 against most cancers. You realize that we had spoken a lot previously about awaiting year 2035. That was the reason, because a vaccine is supposedly going to be available in 2035 against most types of cancers. The rapidity and success with which the world addressed the COVID-19 pandemic gives us every reason to hope. The use of chelation therapy allows us to reduce the amount of heavy metals in our body. Chelation therapy is mostly available in hospital settings, thus removing it from access by the common man. More recently, however, oral chelation therapy has been made available. Every effort should be made available to roll out these options for access to the ordinary man, because as seen above in the case of Herceptin and olaparib, cancer treatment is excessively expensive with only average success. Common sense measures. The treatment option with Herceptin and olaparib has been virtually priced out of the reach from the less developed countries. In fact, even the first world countries as in the UK, olaparib only recently last year became available to the British patient despite being available to US citizens over 8 years earlier. The experience from those overpriced medications leads us back to the Southeast countries for lessons. Whether they know it or not, their dependence on Mother Nature has blessed them with the world's lowest incidence of cancer. Should we not make better use of the soursop or graviola plant? the brown seaweed, and the fucoidan they contain, or why not use the combined medicinal mushroom preparation known as AHCC, or quercetin, or the modified citrus pectin or pectocell C, and prostacade to ward off. The treatment option with Herceptin and olaparib has been virtually priced out of reach from the less developed countries. In fact, even in the first world countries as the UK, olaparib only recently, last year, became available to the British patient despite being available to US citizens over 8 years earlier. The experience from these overpriced medications leads us back to the Southeast countries for lessons. Whether they know it or not, the dependence on Mother Nature has blessed them with the world's lowest incidence of cancer. Should we not make better use of the soursop or graviola plant, the brown seaweed, and the fucoidan they contain, or why not use the combined medicinal mushrooms present in AHCC or quercetin, or the modified citrus pectin of pectocell C, and prostacade to ward off prostate cancer? Topical iodine can be useful in the fight against breast cancer. Our bodies and pockets will show gratitude for a longer and healthier life. But not only that, we also need an adjustment to our lifestyle. So what lifestyle changes should we tend to adapt? If the report from the journal Nature is correct, that most cases of cancer are caused by factors external to our bodies, if the report from journal Nature is correct, that most cases of cancer are caused by factors external to our bodies, after boosting our internal army or our immune system and its components, should we not aim to keep our exposure to carcinogens to a minimum through a push to change our lifestyle? Be mindful of what we ingest or expose our bodies to. We need to be prepared to migrate from the vices of modern living and move more. The sedentary lifestyle and increased weight gain from the toxin we ingest, as well as the vices of modern living, such as cigarette smoking, alcohol consumption, coupled with poor stress management of modern living, demands that we address our ill health now, and Phillip Academy is delighted to continue to make its contribution. We advocate making our body immune to cancer by our two-step approach. A, strengthening our immune system, and B, modifying factors outside our bodies by limiting our exposure to them. We believe that by strengthening our immune system, if an oncogene threatens our health, we have an army of internal fighters ready to go to war to defend our bodies against the insult any such oncogene can cause. Further, by limiting our exposure to the variety of external insults against our bodies, we will create the environment necessary to address many health concerns. This is the end of Cancer, episode 4. In this section, we discussed prostate cancer. We suggested a screening test and advanced reason why it is not more widely used. We gave values which can be useful in guiding management. We looked at an equivalent female screening tool which is not exclusively able to predict ovarian cancer, but which is widely used, generating anxiety and fear among our female folk. And we also introduced the concept of risk of malignancy index. We discussed steps in making your body cancer-free and advised on the need for early presentation if you think that something is wrong. We also declared the Academy's modus operandi, that is, to be the healthiest version of yourself. So let's recap. We have now completed 4 episodes of cancer. In episode 1, we looked at how cancer developed. In episode 2, we explored lessons from the East. In episode 3, we looked at 3 specific types of cancers which allow varying ways of being able to predict their existence. In episode 4, we discussed prostate cancer and looked at the reluctance to roll out PSA as a screening tool, but the embrace of CA125. We hinted on the need for a national prostate cancer screening program. We also discussed nuggets to ensure we make our bodies cancer-proof. Further reading, provided in greater detail, is information on these diseases, as well as others, which is present in my book series, Reclaiming Your Health. The increased details on cancer will be found in the book with the subtitle Cancer. An image of the book cover is seen at the start of each cancer podcast. This book provides you with both a useful guide and an important resource material, or reference material if you will, that will ensure that you always have this useful information at your fingertips. Reclaim Your Health is a library of 12 books which seeks to address the 9 common chronic health challenges of our time. There are books on cancer, Alzheimer's or dementia, cardiovascular disease, diabetes, arthritis, obesity, chronic lung diseases, chronic kidney diseases, bowel diseases, and women's health, men's health, and stem cells. I thank you.